Hey there, medical enthusiasts! Welcome back to our channel, where we dive deep into fascinating medical cases to sharpen your diagnostic skills. Today, we have a compelling case of a young man presenting with some concerning symptoms. So, let's jump right in. Alright, here's the case. A 24-year-old man who has shunned regular medical follow-ups walks into the clinic with complaints of shortness of breath and chest pain. Now, this is already raising some red flags. Let's see what else we can uncover. On examination, his blood pressure is 145 over 82 millimeters of mercury. He is cyanosed and short of breath, even at rest. Now, cyanosis indicates a serious underlying issue, possibly related to heart or lung function. Given this clinical picture, what do you think is the most likely finding on further examination? Here are your options. A. Diastolic murmur. B. Persistent hypoxia despite maximal oxygen therapy. Tapping apex beat. D. Broad P waves on ECG. E. Decreased pulmonary vasculature on CXR. Take a moment to think about it. What's jumping out at you? Given his symptoms and the examination findings, what could be causing his shortness of breath and cyanosis? Alright, let's break down each option. Option A, a diastolic murmur. This could suggest various cardiac conditions like aortic regurgitation or mitral stenosis, but it's not the most common finding in a young adult with these symptoms, unless there's a history of rheumatic fever or congenital issues. Option B, persistent hypoxia despite maximal oxygen therapy. This finding suggests a significant right-to-left shunt or a problem with oxygenation that isn't correctable with just oxygen, like in cases of Eisenmenger syndrome. Given his cyanosis and lack of medical follow-up, this seems quite plausible. Option C, a tapping apex beat. This is typically associated with mitral stenosis, which is a condition we usually see in older patients or in those with a history of rheumatic fever. It's less likely in a 24-year-old without such a history. Option D, broad P waves on ECG. Broad P waves suggest left atrial enlargement, but this isn't directly aligned with our patient's immediate symptoms of cyanosis and severe shortness of breath. Option E, decreased pulmonary vasculature on CXR. This finding is more typical of chronic obstructive pulmonary disease or other conditions that cause chronic hypoxemia, but it doesn't quite fit with the acute presentation in this young man. So which one is it? If you chose option B, persistent hypoxia despite maximal oxygen therapy, you're absolutely right. In a young patient presenting with cyanosis and shortness of breath, especially one who hasn't been seen by a doctor regularly, you should have a high suspicion for congenital heart diseases that may have led to a right-to-left shunt, like in Eisenmenger syndrome. These patients remain hypoxic despite receiving oxygen because the underlying cardiac shunt doesn't allow for proper oxygenation of the blood. Fantastic job, everyone! This case emphasizes the importance of considering congenital heart defects in young patients with these symptoms, especially when they've avoided medical care for a long time. Stay tuned for more cases, and don't forget to like, subscribe, and hit that notification bell so you never miss a diagnostic challenge.